Okay, welcome everybody. Good afternoon. We are now in the session of gaps and fragmentation of pancreatic cancer patients management across Europe, the PancreOS Project preliminary results. On behalf of Pancreatic Cancer Europe, I welcome you to this session. One of the activities of Pancreatic Cancer Europe is the creation of a network of the exocrine pancreatic cancer registry already existing at the European Union. There are 22 registries that have shown their interest in joining this project, and 6 of them have already started to dump their data in the common database that RedCap provides as a platform. These are aggregated data that guarantee anonymity and compliance with the European data protection law. Population-based registries are also participating, as well as hospital-based registries, and the objectives of this initiative are to know the diagnostic and therapeutic procedures and the survival of the patients included. Also, to know the existing clinical and translational research programs. Their incidence and mortality can only be calculated in the population-based registries, as you know, and it will help us to know better its different type of biology, the areas of improvement in each country, and will stimulate the network grouping, the working network in an homogeneous way, to know the data in real life of the programs of prevention, of diagnosis and treatment of pancreatic cancer, as well as to propose and implement actions in prevention policies, research and therapeutic strategies that improve its survival. Pancreatic Cancer Europe has many other programs, but this is one of the main programs that already exists, and we are happy that this is moving forward as we have the commitment to defeat this deadly illness, and there is much room for improvement ahead. So we have the program with very impressive talks and specialists that are going to present the preliminary results.
I will. Yeah, lo presento.
So the first one
first is Raquel, yeah?
Is going to be Raquel Benitez, already on stage, that is going to talk to you about the project preliminary results. When you want, Raquel.
Thank you, Alfredo. Good afternoon, everyone, and thank you for attending to the session. It's my pleasure to present today, as Alfredo mentioned, the preliminary results of the PancreOS project. PancreOS project itself is defined as a network of registries on pancreatic cancer across Europe. Its main objective is to provide a comprehensive view of pancreatic cancer patient management around the continent. But it will also, the other objectives that are also very important to these projects were to foster the accuracy of pancreatic cancer data gathering and also reporting. With this project, we would like also to stimulate and support the cooperation among the registries participating, and of course, it will promote a better understanding of the disease and the development of more effective prevention policies, diagnosis strategies, and also the personalized treatments. The achievement of the projects from 2022 to nowadays started by the map and characterization of the existing registries on pancreatic cancer in Europe. Then we contact them to create connections, and those who accepted to participate and show their interest in the project design with us the list of variables that will be collected during this project. variables related to pancreatic cancer, of course. Then we also implemented in parallel the online system in which we will collect the summarized data, as Alfredo mentioned. This is based on the open source tool called RedCap. Then we also designed the PancreOS Statistical Analysis Plan. As Alfredo mentioned, this project is based on summarized data, not on individual data, and it's not that simple how to manage the analysis. So that's why we also put huge efforts in designing this plan. Then, during this process, we have also achieved a consensus and signature of PancreOS participation by getting the agreement with them. This is also a key point. Everyone has to feel safe when participating in this type of projects. And then, finally, we start the data collection from the first registries that are already providing the data, which at the moment are 7. And of course, we are starting to report on pancreatic cancer present registries activities in Europe based on the data that we already have. It's worthy to mention the registries that are providing the data at the moment, which are the one based in Girona, Backup in France, the cancer registry in Castellón, the one based in Slovenia, also the Swedish one, and the one based in Hungary. Also, the cancer registry based in Germany is already providing the data, but we didn't have time to introduce the data for today's presentation. That's why it is not highlighted in bold. And then the Murcia cancer registry also started very recently to provide the data, but we didn't have it completed, so it's not included in the presentation either. So, well, we were very aware that we need to break down our goals into a small step in order to achieve our big objective, which is to provide this comprehensive view of the pancreatic cancer patient management in Europe. To do so, first, we divide the pancreatic cancer into the different presentation of the disease that we can identify in the different registries, by the histological confirmed pancreatic ductal adenocarcinoma, but also the adenocarcinoma not otherwise specified, but in pancreatic cancer. Then we are aware that there are many, and we will comment on this later, many pancreatic cancer that do not receive an histological confirmation, and this should be grouped in a different state. And then we also collect the rest of pancreatic cancer types that are confirmed histologically, but they are not PDAC nor adenocarcinoma not otherwise specified. For this phase 1 of the project, breaking down our goals, we are collecting all the data based on a group that summarizes the PDAC plus the non-otherwise specified. But we also asked to all the registries that are participating the specific number of all these 4 groups in order to make comparisons. For the moment, 25 registries have expressed their interest in participating in PancreOS, and they have completed a very brief questionnaire in where they report the main data that they have in the registry. And as I mentioned, 7 already provide the data, but the results that we're presenting later on are based on the 6 that we have time to process for today's meeting. So just to summarize, and based on the 25 registries that are already involved in the project, most of them are population-based, but we have also some that are hospital-based or registries that combine both types of information. Regarding the tumor type, most of the registries that are participating are collecting information not only in pancreas, but in all tumor types. We have some registries that are focused on digestive tumors, and only 3 of them are specifically dedicated to pancreatic cancer. Regarding the coverage, most of them are regional, but we also have registries at national level. And for the cancer type, as consequence of that, most of the registries are focused on all tumor types. They are collecting all pancreatic cancer, but some of them are focused either on register type, just one, and the others are only focused in pancreatic ductal adenocarcinoma. The other part of the information that we collect with these 25 was if they collect clinical information in the registry, epidemiological information, follow-up, and also if they have access to a biobank or not. And, well, of course, the lowest amount of registries having this information were regarding biobanks. Now, as mentioned, I will present the results that we have, preliminary results from the 6 registries that already provide the data. In this plot, in where we can observe in the x-axis the different groups that I mentioned before, and in the y-axis the total in raw numbers, the number of pancreatic cancer collected per registry differs, but what we can observe here is the fact that we mentioned before that most of or many patients, due to the health conditions when they arrive to the diagnosis process of this cancer, they are not confirmed histologically. Then they are not reported as the histologic type, so we don't know if they are PDAC or not. Regarding the age distribution of the registries that already provide the data, they are more or less as it should be expected. The difference between them are not significant. And when we check the overall age distribution by the registries, which is on the left of the presentation, yeah, the brown one, more or less, we observe that this is a trend that is expected in Europe for this, is reported in Europe, I mean, for this type of cancer. Moving to the diagnostic procedures in the data collected by PancreOS, what we were asking to the registries, or what we are asking indeed, is if they have information about the diagnosis process. Is it was by cytology from the primary tumor or the metastatic, or maybe by surgery, or maybe for some patients that do not have the information. We also ask for the tumor tissue obtaining a diagnosis, if it was from metastasis or for the primary tumor or both, and also the imaging, if they use an imaging diagnosis. When we ask this, in this table are representing the information that they reported. In the first column, where we are presenting if they do collect this information or not. And as you can see, the Slovenian registry is the one that is not collecting this information at all. If in the table is presented that the information is not available, it means that they are collecting this information or they have access to it, but they do not have the data ready to be provided to PancreOS. In this regard, what we would like to highlight in this is that we need more data in order to understand the difference in diagnostic procedures across Europe. We need to gather more comprehensive and standardized data to make all this information comparable. Regarding the tumor data that has been collected, we asked the registries about where the tumor is located, if it's the head, body, or tail of the tumor. We also asked about the stage of diagnosis, if it was resectable or not. And we also asked about if they are collecting the clinical TNM and in which edition. Again, here are summarized the data that they're reporting. In this case, all of them collect information about the tumor and the location and the state. In the TNM, it was difficult to compare them because they were reporting in different TNM systems, not all in the same. Regarding the location and the stage, I will show you some plots just to give you an idea on how this data differ across the different registries. Regarding the tumor location, for example, we can observe that in the first registry, which registries are indicated in the x-axis, are represented the backup, which is in France, and they are collecting the information whether in which part of the pancreas it is present, or if it's in another location, or if it is overlapping different regions. So they do not have non-defined category. On the other hand, when we move to Castellón registry, they are only collecting if the tumor is in one of the three parts, and the rest, probably, that are in other location or overlapping, may go to the not defined one, and so on. When we move to the tumor stage diagnosis, we observe also a disparity in how the registry collect the information, if they have the same categories or not. I would like to highlight at this point that we cannot compare the different, in terms of if there is difference between countries or not in the tumor stage and the tumor location, because the periods in where the information is reported is not controlled in this analysis. And this is summarized data, so it makes difficult comparisons. But what we would like to bring as a take-home message of this is that there is a need for standardize the data. The collection of tumor data is crucial for better understanding this and make the comparisons that are sorely needed across Europe. Then, regarding the treatment data that we collect, we ask for the surgery intention and also the type, if they receive or not radiotherapy, and the same for chemotherapy, including the type of chemotherapy that they receive. And again, you can check here if they have the information or not, or if they do have the information, but they couldn't provide, because of how it's prepared or listed or whatever, they couldn't provide to us. Again, here I'm showing you an example of the treatment, the chemotherapy. And as you can see, we cannot compare between countries, but in here is more homogeneous, the way that the information is collected. They almost all of them have the same categories, except for the Slovenian Cancer Registry, which is not reporting if they are receiving the chemotherapy, neoadjuvant or not. But again, our take-home message is that there are a huge variability probably in treatment across the different countries, and the treatment approaches for pancreatic cancer across the different regions need to be characterized to make this comparison and to check if this is affecting patient outcomes or not. As per the survival, here are again represented the information that we have for the 5 registries that could provide this data. But as you can see, they are from different periods, from different extensions, so they are not comparable. And what we are asking here to the registries is the percentage of patients that are still alive after 12 months of diagnosis, 24 and 36. But there is a huge challenge in how the information of survival is collected by the different registries. And this data collection needs to be consistent and accurate to make able to identify the significant challenges that are around Europe regarding this disease. Finally, as a conclusion of this presentation, I would like to reinforce the idea that we have been repeated during the presentation, that is that there is a need to agree on the variables to be collected and to standardize the data collection process. Also, with this initiative, we are able to provide information on pancreatic cancer diagnosis, treatment, and survival in Europe. We can identify the heterogeneity of management and outcomes among the countries, and we can point at the issue for improvement. In addition, this information is not only valuable for us, the researchers, but also for patients, healthcare providers, policymakers, and other stakeholders. As a final message, I would like to say that PancreOS is necessary and beneficial to society, and we will make a real and fundamental change in what is known about the pancreatic cancer in Europe with this initiative. And of course, to invite you all to spread the word, and if you know someone who are involved in registries or may be interested to participate in this initiative, please contact us, because all the registries and efforts to join to these projects are more than welcome. And well, since this is a roundtable, I will jump directly to the thank you slide. Here are our contacts. You can contact to PancreOS, which is my specific email, or also to the PCE, and they will direct to us. So thank you very much for listening, and I leave the floor to the experts. Thank you.
Thank you very much, Raquel. Excellent talk. It's my pleasure to introduce you to Nuria Malats. She is the head of molecular epidemiology at the National Cancer Research Center in Madrid, in Spain, and she is also coordinating the PancreOS Registry. She will chair the panelists that are participating in this discussion.
Thank you. Thank you, Alfredo. I'm happy to co-chair this panel debate with you, and I welcome all the panelists and you all to participate also in what we hope is an active and very proactive discussion at the end with you all. So data. And data is appropriate, and standardized data is fundamental to understand what happens in Europe regarding pancreatic cancer patient management, which are the gaps and the heterogeneity in the management across European countries. So this is the main aim of this discussion, in which we want to bring different perspectives. The first, Giovanni Marchegiani, you know, he's expert in treating pancreatic cancer patients, so he will bring the perspectives of the clinician surgeon, actually. It is Rafael Marcos-Gragera. He is the head of the epidemiological and cancer registry in Girona unit, and he will bring the perspective of an expert in cancer registry, and he has been very much involved in PancreOS. Then Carmen Martos, who is an expert also in cancer registries at the European level, jointly with policymakers in this regard, will also bring this perspective. And Carmen is now working in Valencia, in the Fundació per al Foment de la Investigació Sanitària in Valencia. We have also the perspective of the patient organization, and this is Francisco Lozano from Cancer Patients Europe. Natalia, my right-hand side, Regidor Alvarez, she is from AstraZeneca, and she will comment the perspective from the industry. And finally, but not least, last but not least, Tit Albrecht, who is from the National Institute of Public Health in Slovenia. He has a broad view on European health policies and will also comment in this regard. So let's start by asking to Giovanni about the data. Which data registries and these databases should gather in order to to draw this scenario that we were aiming to?
Yeah, so first of all, I would like to congratulate this initiative. I was really looking forward to this, and I was really amazed by the efforts and by the preliminary picture that we already got from what has been done so far. We can already say that we really need this because what's coming out is heterogeneity. This was a key word, in the first talk. I would like to congratulate Raquel for the effort. And this is exactly what we want to overcome together. And as a clinician, as a surgeon, as a pancreatologist, as I would like to define myself, we are well aware that data from registries, as you asked me, they provide us a unique opportunity to, as you said, picture what we've been doing so far and identify the gap areas which are crucial for our research. During these days at EPC, we are extremely lucky to see the preview of some extraordinary trials. As clinicians, we love to run trials. But sometimes we fear that they don't provide the actual picture of the current practice in Europe right now. There are issues about patient selection or given treatment that might not be available, somewhere in Europe. But we are part of a community, so we have to have a broader view, and that's exactly what comes from registries like this. So in the end, I think what we need to bring this data at a different level, and I'm talking about stakeholders, even the EU, is to provide quality indicators, which means how should we manage the level of quality that we have right now at all different levels. And that's why I think that this is really crucial, and we have to do it together to identify how this can be done better, because it's already clear that we are probably speaking different languages. We used to say pancreatic cancer is not one disease, but the treatment should be top level anywhere in Europe right now. So again, I very much look forward to developing this together.
So thank you, Giovanni. Yeah, and this is very important what you said, because actually we need to join efforts between different societies in order to identify which are the indicators, which are the variables that are needed in order to have the best picture of pancreatic cancer patient management in Europe. What we have presented is the data that is available right now at present, but we need to further improve that data jointly with the registry. So let me go now to Rafa. Rafa, you as an expert of population cancer registries, what do you think about the quality of the data? And in this regard, do you think that we can improve it, and how to improve the data, and also to extend the data that is already collected?
Thank you. First of all, it's a pleasure to be here, and thank you to Nuria and Alfredo to invite me to participate in this roundtable. It's clear that the cancer registry can improve the management of patients with pancreatic cancer, but we have to clarify that one of the main objectives of the population-based cancer registry is the comparability of the data. Mainly in the epidemiological indicator as incidence, survival, and prevalence, which require standardization in data collection, as I mentioned, Giovanni and Raquel. I must add that population-based cancer registry are not monographic for a given tumor, in this case, pancreas. Therefore, the number of clinical variables is limited in cancer registry, as showed Raquel in the presentation of the PancreOS. An opportunity to enrich with clinical data would be to able to link the data with clinical registry, for example, biobanks, clinical trials, and so on, with population-based cancer registry. One of the main criticisms by clinicians and research is that the data from population-based cancer registry is updated, making it difficult to evaluate advance in new treatment in real time. Cancer registry should optimize data collection to make it more timely. Another problem is that in some countries, such as in Spain, we don't have a full coverage of population by population-based cancer registry. At present, we only have the information about the 26% of the Spanish population that is covered by population-based cancer registry. And those provinces with a large population, for example, Madrid and Barcelona, they don't have population-based cancer registry in this moment. Furthermore, we must take into account the information that we have available on pancreatic cancer. In more than 50% of patients, there is not histological confirmation. This is a reality. We published this data in 2020 with the data from the Girona Cancer Registry, and surprised me because more than 50% of patients, we don't have histological confirmation. Of those who do have a confirmation, in many cases, the diagnosis is through cytology, which make this histological diagnosis not sufficiently precise. Another characteristic due mainly to the prognosis of the patient is that the 70% of patients in real world data, the 70% of the patients are in stage 4. From an epidemiological point of view, we need to improve many aspects of cancer registry in order to improve management of pancreatic cancer patients. Thank you very much.
Thank you, Rafa. So it's very important to consider different sources of data, not only population data registries, but even studies, clinical trials, for example, as Giovanni said, that can complement the data of
population-based cancer registry
management, yes. Overall, But this is not a trivial effort. But in any case,
it's not easy.
Yeah, it's not easy. So can you pass the micro to Carmen? Carmen, from your perspective at the European level, which is the links that we need between policymakers and cancer registries in order to make it possible?
First, I would like to thank to Nuria and Alfredo for inviting me to this very interesting roundtable. Focusing in the question, in my opinion, cancer registry are providing very useful information for planning and evaluation any control cancer program. And this information is very useful for the policymakers. In this framework, for example, cancer registry, as been mentioned by Rafa, are providing information on incidence, prevalence, and also survival. Is possible to identify the group of population at risk a higher risk and also the areas with higher risk. And this information could be used by the policymaker in order to selection priorities and also for allocating health resources. Also, the evaluation and the analysis of the survival can be very useful in order to evaluate the management of pancreatic cancer patients. And also, the cancer registry can provide information about treatment and tumor stage. And with this information, it's possible to evaluate new treatments in a real world, with real world data. And also, it's possible to identify inequality in assessing to this best treatment and diagnosis. In my opinion, the policymaker need the information from the cancer registry, and the cancer registry need the policymaker to support them and to advance in the management of the pancreatic cancer patient.
Thank you very much. You raised an important point, that it's inequalities, okay? Inequalities within a country, but also between countries. And this is the aim of Europe, to decrease and to handle these inequalities is a very important objective at the European level. So thank you very much. So let's now jump to the patient perspective with Francisco. Usually, cancer registries, when we think in drawing this picture, this scenario, we barely think on the needs or the worries that patients you have, no? At patients with pancreatic cancer. So, from your perspective, what would be the major obstacles that you can identify in order to, from patients to be treated correctly and also without these inequalities that we were mentioning?
Well, first, of course, thank you very much for inviting us, the patients, to be present here. Thank you, Alfredo. Thank you, Nuria. It's very important for us to be here and to bring our inputs, our points of view that probably are not clinics, but I think are important. It's important to participate in this type of debates. From the point of view of the patients, probably, no matter where a patient lives in Europe, usually the diagnosis is in a later stage. There's no difference in countries, in one side or other of Europe. Usually the late diagnosis for us is probably the major obstacle, because when we have a late diagnostic, we are in a point where we can find useful treatments, and that's very important for us. Second point should be to say that probably the industry has not much interest in research and in develop new treatments, new and effective treatments for cancer treatments. That's a problem. That's a problem. Even to participate in clinical trials is difficult. It's hard, and there are not many clinical trials. And well, this is another barrier to solve the problem. And of course, a third problem, it should be that this pancreatic cancer should be treated in specialized centers. And it's not easy due to the number of cases that is not high. Probably we can find specialized centers in certain capitals of regions, but they are not well spread out in all Europe. So it's the distance to the center to be treated, I think, is the geographical distance is another point that is, for us, is a problem. And so these are the 3 points that I could say here now.
Thank you, Francisco. Yeah, this latter point, referral centers or units is a key point also in increasing survival in pancreatic cancer and to have better managed, that's for sure. So should we also consider these points in the registries, in the data that we are collecting, whether the patients have been treated in the referral centers, because this is usually not considered in the registries, well, the delay is usually then estimated, no? And the second point you said...
the interest of the
interest
in research and develop new treatments that
and also whether the patients have been included or not in clinical trials, no? So let's think, and maybe we can work together also in considering this regard. So for allusions, now I think it's you are, Natalia. Your point now to address the challenges from the industry and to answer.
Okay. Thank you very much, Nuria and PCE, for inviting me to this interesting roundtable to discuss about this aggressive disease with so many unmet medical needs. And I will give the perspective of the pharmaceutical industry, but I work in AstraZeneca, so I will speak about my perspective. I think that one of the most important things for the development of new drugs is to understand the patient needs, to understand the disease, the clinical characteristics of the disease, and the molecular biology of the pancreatic cancer. And this is one of the most important gaps that we have to develop drugs. In the last, I would say, 20 years, maybe, many clinical trials have failed, and, but we have evidence that the targeted therapies have a role in this disease. So I think it is very, very important to perform the histological confirmation, to perform biopsy, to analyze the molecular profile of the patients, to identify the key biomarkers, to go directly to these biomarkers to develop the drugs. Then we have to design good clinical trials, we have to get positive results, and then we have to get the approvals. And for that is very important this kind of registries where there is a lot of information to explode and to analyze, to show the authorities, the European and the local authorities, the importance of the approval of these drugs. So this is another important point that we have to face from the pharmaceutical industry. Okay. And regarding the allusions, I can say that in AstraZeneca we have a clinical development program for pancreatic cancer with several clinical trials. In the group of precision medicine, we are developing some targeted therapies directed to different biomarkers, to different targets, and we hope that in the following years we will have positive results, but it's not easy.
Yeah, thank you very much.
No, thank you.
One of the main things that were responsible of this big failure in clinical trials in the last 20 years is that the population was not selected. Everybody was included, and we have quite different types of pancreatic cancer, and we need this molecular-based selection in order to stratify the patients and include some of them and others not in the targeted therapy trials or whatever.
So now we know it, so we have to do something regarding that.
Yeah, actually this would require to have biobanks linked to the cancer registries or to these databases, huge databases. And can you imagine how will be the heterogeneity of this kind of information gathered in the different countries and also in different regional, at the regional level, etc. So to be compared with, I mean, this is not to disregard the importance of this specific point. We have to go ahead and to get this information, but this will be quite tough thinking of cancer registries right now. Thank you very much. So, Tita, for your perspectives at the national health system, not at the local level, but also at the European level, what's your comments follow this regard.
I think these presentations already showed the three groups of big challenges. One is definitely continuing the efforts of registry strengthening. I mean, we have an excellent network, European network of cancer registries, which is a methodologically strong research-based network, of course supporting also logistical issues and challenges of the registries. And I think that, of course, Carmen already mentioned, we have to push for the policymakers to understand that only very granular data at the collection level will give us strength that we need for taking responsible and, of course, informed decisions. The second was already touched by Francisco, the relationship between centralization of care and decentralization. Of course, for the patient who lives in a remote area and has to travel somewhere far, I mean, even if they can be located in that center, this is, of course, a stress for the patient, for the family, for the close ones, which they need the support of. And this is of course, we know we have a lot of evidence that we need, for high quality, we need close link to the third topic I wanted to raise, and it was already, of course, underlined by previous speakers, is the close link between care and research. And this is, of course, in a cancer that still needs a lot of development. I mean, all cancers need, of course, but pancreatic, because of the shortcomings that we have in survival and in late diagnostics, this link is essential. Of course, for some European countries, this is a big challenge. And we're not talking only about countries with, let's say, lower income, but we are talking simply of the small populations. But we already found solutions. We have European networks for pediatric cancers. We have European networks for rare cancers. Of course, pancreatic is not a rare cancer by strict definitions, but of course at the level of these small nations, it can be considered almost rare. So cross-border collaboration and involvement of patients in cross-border trials, I know many people start, rolling their eyes by mention of cross-border, but this is definitely going to give us more power. Finally, yes, surgery is probably one of the rare things where you need organ-based concentration. So a surgeon that is specialized for pancreas should operate on pancreas. For other aspects, genomics, medical oncology, and so on, this is now a little bit more diverse. And it goes in different ways. Specialty, but also molecular-based and research and so on. Research will be strengthened also by the evidence that will be provided by the links between the population and the clinical registries. We cannot have only one or the other, or say, like some countries do, I'm sorry to criticize, but well, with clinical registries, we will put together the data and then we will have a picture. You should have population-based registries, because then you have a follow-up. You can really follow and see what happens in real time. Thank you, Nuria and Alfredo.
Thank you very much, Tit. From the audience, is there anyone that wants to comment or make a question? No, I cannot see, so please shout out.
The lights, please. Because we cannot see.
So if not, maybe to finish this debate and to make it a little bit more dynamic, what would you think would be the next steps, the next phase for this project, for this initiative? How would you advise PancreOS to go ahead? Any of you? You have the micro, maybe Tit, since you're finished, you can start.
I think definitely we should seek support from all European countries. I think the variations, some of the variations are probably to be expected. Some are the result of the different methodologies. And I think that Rafa could tell us all a lot of the experience about aligning methodologies across different countries, because this is a very painstaking thing. But of course, if we want to get more power and also compare results, this is definitely something that we need to aim at.
Thank you. Natalia, yourself.
I would say that it would be very interesting or very important to include the sample analysis, the collection of samples of all the patients included in the registry, and maybe use the artificial intelligence or some of these new technologies to analyze the data and to compare with controls or histological series or something like that to optimize the analysis of the data, maybe.
Thank you. So, Rafa.
Yes, I think the main problem, as I mentioned before, is to join different population, different cancer registry, type of cancer registry. I think the problem is the lack of standardization of the data. For example, in treatment, treatment for cancer population-based cancer registry is very difficult to collect this information in a standard way. For this reason, in order to analyze the data about the treatment and stage, for example, as Raquel mentioned, there are different type of classification in order to collect the information about the stage. For treatment, is a mess in cancer registry to obtain the information about treatment. I recommend for PancreOS the standardization of the data before to include the cancer registry in this project, because the way to obtain the data probably is different, the definition of case is different, the follow-up is different, and I think to follow a standardization of the collection of the data.
Thank you.
Thank you.
Carmen.
I agree with Rafa, but also there are some European initiative that is important for this, because there is a ENCR, European Network Cancer Registry Working Group, trying to standardize the data collection for treatment, also for recurrency, that at the moment cancer registry usually are not collecting, population-based cancer registry are not collecting this information. And now there is an effort in order to improve the data collection, clinical data collection from the population-based cancer registry. And now also we are participating, Rafa and me. There is a new joint action for improving the data in the European population-based cancer registry. Just starting now, we are in the negotiation about with the majority of the European countries. I think it could be a starting point for improving the data completeness and the data quality of the population-based cancer registry.
Thank you. Giovanni.
If I can add something, well, the feeling that we have dealing with pancreatic cancer, and again, I mean, as a surgeon, we really like to be very proactive, is that we really have no time. So we really want to stress the fact that while we are collecting data, something is already happening. We have new diagnoses every day. And this is really something that at a political level probably is not really heard enough, because we really have to fight against a biology that gives us no time, literally. And so as we feel it as a true medical emergency, I really think that the next step of registries like that should be, again, proactive, like we try to do. So the way I see, and we've been doing this in Italy at a national level, is screening and collecting data from people at risk of developing pancreatic cancer. And this is something that we can do it really now. And in this way, we can identify, and we have data, we've published that recently, that yes, in this way, one of the keywords that I heard was early diagnosis, then in this way we can really have early diagnosis. That is the only way right now, not in 5 years or 10 years, together with molecular analysis, of course, but that is the only way to have better outcomes for our patients. So I see a next phase of this registry, not just, I know it's already a huge effort, but to try to dream big is not only on those diagnosed with the disease, but also those who are at higher risk of developing so-called familiar cases, or also individuals at higher risk, so pre-neoplastic lesion, because in this way we can really impact now on prognosis, looking for development of science and to have more fun to provide new research, because really it's an emergency and we literally have no time already.
Yeah, fully agree. So let's listen now the voice of patients. Yeah.
Well, again and again, I think that more research is needed to identify, in any way, to try to understand much better pancreatic cancer in its early stages. I think this is essential. And, well, we should allocate some type of incentivization to young researchers and young practitioners to try to work in this line. And also, going back to the specialized centers, I think it's important to, for instance, there's a good network of breast units. I think we can do more or less the same with indicators, clear indicators, and evaluating those indicators. I'm trying to build a network of specialized centers throughout Europe, because we need that. We really need that. So I will insist in research with young people, but trying to identify pancreatic cancer in early stages. That's absolutely essential. That's my point.
Thank you. Thank you very much. Is somebody, I cannot see who was, you?
Okay.
So
yeah,
let's...
Yeah, you have a mic.
Yeah? Okay.
Just a short question. I know that the answer is not short, but please, we need a short answer as well. Here there are a lot of people from many different countries. And I was a bit surprised. First of all, congratulations for the initiative, something that is absolutely mandatory to have. I was a bit surprised that there are so few countries, and that the majority of the main countries in Europe are not represented at all. And I would like to know why. I know that this is not a short answer, but...
Probably it's Raquel who can better answer that. But she did a huge search of cancer registries across Europe, and she contacted all of them. So not all of them are responded. We are pushing this, still not going behind and following up our first contact. But yeah, that's it. So first, not all countries have national-wide cancer registries. There's local, regional. So this provides just a partial picture of what is pancreatic cancer, the pancreatic cancer in Europe or at the local level. But still, if we don't have them involved and providing data and joining efforts, that this is the point, joining efforts between all of us in order to give and to frame what is pancreatic cancer.
Then I hope that being here people from many different countries, I think this is the time to move forward and to collaborate. Otherwise, we will never have any kind of minimal results.
Thank you very much, Enrique. This was actually this was the goal of this session, to present to you. So I let Alfredo to finish with a sentence, and then I will comment on another action that we do to invite you to participate.
Okay, the panelists just have shown the rooms for improvement that we do have, the heterogeneity that is so obvious when we compare countries and ways of doing things. And PancreOS is a tool that will harmonize everything because it's a consensus tool. We are going to proceed in a consensus form, and we will try to get closer to the European Union of cancer registries to be involved in their methodology. So we have to know what are we doing for showing it to the politicians, asking for help to invest more money on pancreatic cancer, as it is a deadly disease. And then the politicians will help us on moving forward with more funds and more projects. This is a real huge task, but if each one of us contribute a little bit, we will succeed. I'm sure of that. I'm not a romantic, I am a scientific person, but it requires that everybody is committed to fight against this deadly disease that is causing 90% of mortality rates now. And as Natalia said, we need to know our enemy with molecular analysis, metabolomic, eniomics, spatial, transcriptomics, etc., to target the Achilles tendon of this disease properly, and then also to bring the industry the opportunity to invest more in pancreatic cancer. So thanks very much for being here and help us on this task. Thanks to all the panelists with all the bright suggestions, and I give the floor to Nuria.
Yeah, before wrapping up, can you please display the next slide? Because since research is so fundamental also to moving forward in pancreatic cancer, to understand pancreatic cancer. So PCE has set up this research map, pancreatic cancer research map in Europe, and we ask you all, the research groups that are in Europe mainly, so to contribute and to also draw the scenario of research in pancreatic cancer in Europe by providing your data. So please contact PCE Secretariat to provide, to ask for the credentials to enter in this tool and to upload your data regarding which type of research you do, which resources you have, how large is your lab. This will foster collaborations and also foster training for young researchers. So with that, I finalize this debate. Thank you again by thanking all the panelists and you all for participating. And well, so for a nice